Hello everyone, I am Dr. Aparna Bhasker and I'm a bariatric and laparoscopic surgeon practicing in the city of Mumbai in India. And the purpose of recording this video today is to talk about pros and cons of bariatric and metabolic surgery. When I consult my patients, I think as a doctor it is extremely important for me to talk about the pros and cons of any surgical procedure that I'm going to offer to my patient. So let's start with the pros first. I think people who have attempted to lose weight are very familiar with the fact that it is extremely difficult to lose weight, and especially if you've crossed a certain threshold, if your BMI has increased beyond a certain limit, it is extremely difficult to lose weight. So bariatric surgery we consider when a patient's BMI is more than 35 or say 32.5 with any kind of comorbidities. So that is the time we consider. Now what is the pros of the surgery? The advantages are, of course, we are doing the surgery for weight loss, and it leads to a lot of significant amount of weight loss with the surgery. So that is one of the biggest advantages of bariatric surgery, that it gives us significant weight loss. The second advantage that the surgery gives us is that it also leads to improvement of associated diseases such as diabetes, high blood pressure, high cholesterol, risk of heart disease. It leads to improvement in polycystic ovarian disease. So a lot of women nowadays suffer from PCOS, and bariatric surgery induced weight loss leads to a lot of improvement in PCOS as well. Then the surgery also leads to a significant improvement in breathing issues. So a lot of patients who are suffering from obesity have a lot of problem breathing, and they suffer from a condition called as obstructive sleep apnea, which improves extremely significantly after bariatric surgery. So if a person was using a mask before the surgery, there are very high chances that a lot of these patients will not use it anymore. They will most likely go off their CPAP and BiPAP requirements over a period of time. In addition to this, it also leads to a lot of advantages in the sense that in terms of joint pain. So this is very important for my older age group patients who suffer from a lot of knee joint problems, back related issues. So as the weight decreases, the pressure on these joints also decreases, and it leads to a lot of improvement in that perspective also. One of the biggest advantages or pros that I have seen in my patients and experienced it every day of my life is that there is a very significant improvement in terms of self-confidence. So there is a lot of positivity that comes in after the bariatric surgery in most of the people, and this is what I hear day in and day out from most of my patients, that they feel extremely positive. So these are, I think, some of the major pros that we have with bariatric surgery. In terms of cons, of course, we need to relearn how to eat. This is something, these are habits which we have inculcated for so many years, and suddenly after surgery we're not able to eat in quantities. So we need to relearn eating. We need to listen to the dietitian's instructions, and that is one of the major things. We also need to take some supplements like multivitamins, calcium, iron, protein. It is important to take these supplements, and it is important to be regular with them, because if we don't take these properly, then there is a higher chances that we will have side effects which will be difficult to treat later. There is some degree of hair fall which will happen with any kind of weight loss, and that is true for bariatric surgery also. But this hair loss is temporary and transient, and as the weight stabilizes, the hair tends to come back. So these are in the initial few months, these problems are there. You will feel like the food is getting stuck over here, or you have a difficulty in swallowing your food. So these issues will be there, but I think to avoid any kind of cons or problems, it is best that you remain in touch with us, and so that we can solve your problems as and when required, and take it forward from there. I think I will create another video in which we have discussed, or we can discuss these issues which can creep up after bariatric surgery. So thank you very much, and take care all of you.